This video is designed to complement the Melbourne IVF consent form for the process of oocyte retrieval and vitrification, known better to most of us as egg freezing. In order to freeze eggs, we must first prepare them. From the time you get your period or come off the pill, you'll need to use a series of hormonal medications to encourage eggs to grow and mature. The regimen you've been prescribed will be explained to you in detail by our Melbourne IVF nurse. It's my approach to individualised care for every patient. I will choose medications based on your pre-treatment assessments with the aim of achieving your best possible result while minimising your risk of having complications and side effects. In egg freezing, adhering to the medication I have prescribed strictly in terms of dose and timing of injections is critically important. During your cycle, the progress of your egg development will be monitored by ultrasound measurement of the growth of the ovarian follicles. These structures each potentially contain one egg. Ultrasound monitoring is usually performed using an internal ultrasound probe placed gently in the vagina. When your leading ovarian follicles have reached the size of 17 to 20 millimetres, your egg collection procedure will be planned. The egg collection procedure is performed at East Melbourne Specialist Day Hospital under twilight anaesthetic. This means that during your procedure you will be asleep, relaxed and pain-free. Like any operation, egg collection can very occasionally have complications. Statistically, 1 in 1,500 women who have an egg collection procedure, otherwise known as oocyte pickup or OPU, may have a significant complication, such as excessive bleeding, infection, or damage to pelvic structures. All possible operative complications of OPU are outlined in detail in the Melbourne IVF consent form. The egg collection procedure is overall very safe. I conduct these procedures personally under direct ultrasound vision, and serious complications are overall very rare. Ovarian hyperstimulation can occur in IVF and egg freezing when large egg numbers are achieved in a single treatment. However, through preferentially using safer, modern medications, hyperstimulation now rarely occurs. I recommend that most women should freeze 20 to 30 oocytes for a high chance of achieving a future pregnancy using warmed oocytes. If you are older than 35 years at the time of egg freezing, I counsel towards aiming for higher egg numbers, as not every egg will be viable. We expect that when we warm eggs, 80 to 90% will survive intact. On average, 60 to 70% of eggs will fertilise with ICSI, which is sperm microinjection, and approximately 50% of fertilised eggs will go on to form day 5 embryos, known as blastocysts. Each blastocyst has a 30 to 40% chance of becoming a baby, depending on its grading and quality and the age a woman was when her eggs were frozen. Most women who choose to freeze eggs over the age of 35 years require 2 or more treatment cycles to achieve our desired results. Freezing eggs at Melbourne IVF provides your best probability of achieving a baby using your vitrified oocytes.